Tipo, Becky and Ian and Sandia, good to see you all. Got a nice big group already. Hi there.
Hello.
Hello.
Hi, everybody.
Good morning, good afternoon, good evening to everyone. My name is Ani. I work in UNICEF in New York, and I'm going to kick us off this morning or this afternoon, for some people this evening, actually. Thank you so much for joining us for this second meeting of the task force on the thematic brief on social service workforce and children's care. Today, we are going to go over a little bit more into the details of the goal of the task force and the terms of reference of the task force, as well as the overall outline of the thematic brief itself. But before we do that, I wanted to once again thank you all for taking the time to spend an hour with us today. And wanted to very quickly welcome especially those who have joined us today for the first time. For those who for joining us today for the first time, may I request that you introduce yourselves a little bit by opening your mic and tell us your interest in joining this group. And for others who were there for the first meeting, if you could just introduce yourselves on the chat for those who are new, for them to know that you were there for the last meeting as well. If you could just raise your hand, those who are new could raise your hands, and I could just call out the names as they appear on my screen. Thank you so much. Ian, go ahead. I see your hand already.
Okay, thank you, Annie. So Ian Milligan, based in Scotland, worked a lot in alternative care internationally, and done training as well as policy analyses and so on and so forth, and worked with a number of different NGOs and so on. I suppose I've worked a lot on developing workforce in my own country and abroad. And by workforce, I mean a range of different professions and educational levels. And so I'm very happy to be here. This kind of work certainly interests me, even though I'm actually retired from my formal post. Thank you.
Thank you so much, Ian. And we are also very happy that you have joined us, and we will definitely benefit from your inputs. Next on the screen, I see Florence Coindering. Florence, over to you.
Hi, thank you, Annie. I'm Florence Koendrink. I am an independent consultant in child protection and alternative care reform. So this is obviously a very important topic in that I would have been there at the first meeting, but it was at a time when I was unable to attend. So I look forward to hearing where you've got so far.
Thank you so much, Florence, and we look forward to also receiving your contributions and inputs as we move forward. Thanks a lot for joining. Florence Martin? I think I've heard that name before.
Hello, everyone. I know many, but not all of you. I'm Florence Martin. I'm the Executive Director of Better Care Network. My background is I'm a human rights lawyer and a social worker, and I have particular interest in social work development because I did quite a lot of work when I worked particularly in Indonesia and East Timor around social workforce development, and of course through the work with BCN and the partnership with the Global Social Service Workforce Alliance with BCN. So really delighted to be here. I'm also one of the co-convener of the Global Policy and Advocacy Working Groups, which kind of, I'm going to say oversee, but it's not really oversee the multiple briefs that are being developed by different task forces. So thank you for having me, and apologies I couldn't be there at the last meeting.
No, thank you for joining us today, Florence. Thanks a lot. So I don't see any other hands here of colleagues who joined us for the first time, but please feel free to introduce yourselves in the chat. And if we could move to the next slide now, where we will very quickly go over the agenda. Today we will, as we've already had the welcome and introductions, but what we are going to do today is dive deeper into the task force itself. What are the goals of the task force? What are the roles and responsibilities of the drafting committee? And then we will look at the outline that Beth has already put together, and it was shared with colleagues, and some of you actually have already started providing feedback on it, which we are very grateful to you for. So we will spend a little bit more time today on the review of the draft outline of the thematic brief, and then we will conclude today's session with next steps, tasks, and question and answers, which is more like an open conversation for all of us to have to move this agenda forward into the next year. Today, we are going to be spending an hour together. So without any further ado, Beth, can I hand it over to you? Thank you.
Thanks, Ani, and welcome everyone. It's great to see you all, some of you again today and some of you for the first time. We're really happy to be getting such perspectives on this work. So I'm just really quickly going to go over a reminder of what this task force is all about. And then I'm going to make a brief pitch for people who would be interested in joining the drafting committee. I think we have close to 40 members now in the task force itself. So again, thank you for making time to come to this meeting today. Just as a reminder, the goal is definitely to exchange on learning around the social service workforce as it relates to care, children's care and care reform. We really want to be documenting country level examples and putting together a thematic brief that really builds on those 2019 UNGA key recommendations and makes both policy recommendations around social service workforce as well as some recommendations around implementation and practice. So hopefully you're all still feeling like you're in the right place. And thank you for letting me give that quick reminder. Thanks to, I think, Chipo and Sanya, if I'm not mistaken, for already volunteering to join a sub committee, a smaller group who will really be responsible for drafting parts of this thematic brief. The terms of reference for that committee, you can see, I think they were shared in the platform as well. We're really looking for people who can commit to all of these meetings, probably attend a couple of additional meetings, follow the communication closely, review the outline, but also sign up to help draft certain sections of the thematic brief, to write those, to help collect those case and country examples, everyone can review the draft thematic brief, but again, if you've volunteered for the drafting committee, we would be really looking for your active input there, and then perhaps providing additional content or helping to gather additional content once we have a first draft. So this is just my pitch for people to think about raising their hands for this drafting committee. You can put it in the chat now if you know that you're willing and able to help draft the brief. You can email myself or post something to the group after this meeting as well if you need to think about it. Let me know if you have any questions, and I'm really looking forward to having a small group to work actively with on this. And with that, I think I can turn over to Hugh to really take us through the outline.
Sorry, I was puttering away with my microphone closed. Sorry, I was just wondering, maybe I'll share screen to the Google Doc. Is that fine? I mean, many people might have the Google Doc open, but I'll do that anyway. Then you can sort of see which bit I'm looking at. Let's just make sure I have it up there. While I'm doing that, please carry on introducing yourselves in the chat. And sorry, we don't have time for full verbal intros today, just because we've got an hour and we're trying to sort of get to the main part of the meeting. But when you speak to any points, you know, by all means, you know, introduce yourself at the beginning of making your point. Okay, so I've got that open on my computer. Let's see if I can share screen to the Google Doc. Okay, so I'll end the slides screen share. Is that all right? And I'll switch to the
Yep,
outline.
that's fine.
Okay, so many thanks to all of you who've already put in some comments. They're really helpful comments, and we can see how this is a really useful discussion before we enter into trying to write any of this thematic brief to be clear on the purpose and the structure of this outline. It's always going to be quite a big challenge because we're trying to keep something quite succinct and concise. I think the idea is around 5 pages, but I think certainly no more than 10 pages if at all possible. Not just because being concise is good in its own right, but also because we're trying to reach policymakers who might only have time to read this very briefly, like busy policymakers often only do have time to look at things briefly, or someone else will be summarizing it for them. So it needs to be as clear and concise as possible, and we'll never possibly be able to capture all the different nuances and sides to these issues. So there's bound to be some compromise in leaving certain things out. I'll just like to say at the beginning that actually we do have something we've recently decided is that those of you who know this Social Service Workforce Alliance, so we do every year put out a State of the Social Service Workforce report. The one that just is almost finalized and about to go out for 2023 is the one for our 10th anniversary, looking back on progress and achievements and looking forward. And so for 2024, we hadn't until recently chosen a theme, but we decided that a really good theme would actually be built on this theme. So to make the theme for the 2024 State of the Social Service Workforce Report to be specifically around the social service workforce in connection to children's care and care reform, and particularly achieving family-based care. So that our State of the Social Service Workforce Report is normally between about 30 to 50 pages. So that will allow the scope to put more sort of country examples and more of the nuances of these issues into that report. So at least gives a little bit of sort of overspill room, as it were. And the thematic brief, we're going to try and just focus on the core essence. What I'll do, I think, is just briefly, for those who've not had a chance to read the outline, just go through it and just explain the logic that we thought, you know, initially would make sense for a structure. And then we can go through some of the points. And if you're in the meeting, those of you who've made a written comment already in this Google Doc, by all means, maybe you can speak up and explain the points that you're making. And then others, of course, can chip in. I didn't see the chat recently. Is this Google Doc link in the chat now as well? In case anybody...
Yes, it is.
Yeah. Okay, perfect. Thank you. So I think I've explained the purpose of the brief, and the audience is very much the policy and decision makers, as well as development partners and others who support investment in the workforce in particular, and care reform. So the main idea was to have the outline to ensure that we have a balance between looking at systemic elements of the social service workforce that need strengthening in order for the social service workforce to be well positioned to then achieve the outcomes in terms of children's care that we're looking to achieve. So that's why there are sections on overview of social service workforce strengthening, and then this section 3 about supporting the workforce in terms of laws, policies, and plans. And then the next major part, which is section 4, is there about strengthening the actual daily practice of the workforce. So it's really the difference is that the introductory section and section 3 is about the macro, the systemic, and the overall workforce being strengthened as a whole and in relation to the wider child protection system. And then it goes into the micro and the level of daily practice, and competencies in the wider sense of the word. So, you know, knowledge, skills and values, or knowledge, attitudes and practices. So that's the thing that we're talking about strengthening in that section 4. So that was the logic of having that division. I can see some of you have already picked up on sort of saying, well, does it make sense? Why are we putting that here and there? So I think we're definitely going to come to those issues, because it may not still be a fully logical structure. So let's get into these discussions now, and those of you who haven't looked at it can be looking at it as we go through. Hopefully you'll be looking at it in your own browser if you've clicked on the Google Doc. But I'll just start from the top, if that's okay, with these comments. So Ian, it looks like you got in first. So do you want to speak to the points that you were making on this outline? If you can recall what they were, or
I think very, very briefly, I mean, in the opening thing, I mean, I just made a point about valuing the workforce and just mirroring, because we're committed to the children and young people kind of thing. So we have to be committed to those who work with them, the social workers or case managers or child protection staff, and maybe the direct carers, whatever, in different places. So it was just something about valuing people, the humanity of the issue, just a simple presentational point.
right. Okay, great, that's helpful. And I think that's also, we often find it, being an organization that is speaking for the workforce, is that we find that a lot of programmers who design projects and programs with the outcomes for children in mind sometimes think that the workforce is a given, that they just can assume that there will be workforce, or that you train people, they will automatically do the things that you expect them to do. Whereas we actually say that isn't necessarily the case, and the workforce has to be in a position to do this very difficult work. They have to be respected, acknowledged. And so I think that's a good, it's well taken, your suggestion there, Ian. Thank you. We don't have Sully with us today, but I think that the question about defining the workforce, we are talking about mainly the definition of the social service workforce, as opposed to professional social work, or as opposed, understanding what the wider social service workforce is. We obviously have spent a number of years defining that as an organization, and in our documents, as have, very much together with UNICEF. But I think we should redefine it also in the context of this paper, but also saying that this definition is not a rigid thing that gets imposed on people. Then ultimately each country has to make a call on what for them is the where do they draw the line in terms of social service workforce that they're going to focus on in their reform efforts or in their capacity building efforts. So, do they include counselors and psychologists, for example, and do they, if you have someone working in a school, are they seen as coming under the education workforce? But if they're focused on student welfare, are they social service workforce? So there are some gray areas, but we since our inception as Alliance have made the point that the workforce includes professional social workers and paraprofessionals. And it also includes community volunteers who are trained and tasked with a particular role in providing social services. So I think we'd want that to be in there, but we'll definitely want to make a statement that actually exactly how the workforce is defined is a country level decision ultimately, and needs to be contextualized. Ian, you have another, do you want to speak to your other points as well? And then we'll let others speak.
No, I think we need to have others coming in. I'm
Okay,
just
all right.
jotting down 2 or 3 things. That's plenty for me.
Okay, thank you so much. I didn't see, now that I've got my share screen mode on, I did not see if Young Julie is, do we have Young Julie with us today?
No, we don't.
No, okay. So we can read the point that I think she's a UNICEF colleague, isn't that right, Annie, I believe? And I think understandably,
She is, yes.
Yeah, very much right and we're very pleased for her to mention the guidelines to strengthen the social service workforce for child protection. And the whole point about the economic value of investing is very well made. I think that's a big mantra for us as well at the moment. And I think we're always saying, that it's often overlooked and people don't consider the full cost of the workforce, and they're frequently underpaid and under-resourced. So I think we can make that point, but more specifically here saying, you can't have children receiving services in the community so they can stay with their families, or being supported to return to their families if the workforce is under-resourced, and if it's paid for a year and then they're no longer paid, or they're underpaid, or they don't have other services and facilities that they need, then you can't achieve these aims. So I think that point is very well made. Before we go into others, Beth,
Hugh, sorry.
Yeah.
Yeah, I thought this was a great point, just in that if others have documents or resources that should be referenced or that we should be looking at as we draft the thematic brief, it would be super helpful for those to be noted. So feel free to go into the outline and add other references like young Julie has. That's incredibly helpful.
So include links, you mean, and actually directly.
Yeah, or even just I mean, I'm sure if you put the title like she has, we can find it, but
sure,
helpful to know what already exists and what we can draw in based on what already exists.
Yeah, okay. Just I'm interested by that phrase, global polycrisis. My understanding of that's when things like climate change combine with things like conflict and things like economic instability or inflation and poverty and all sorts of different things come together. And I think there is a place for contextualizing the importance of this, because obviously displacements, humanitarian situations, they often result in more children being separated, more children being at risk of losing family care. So that heightens the need for a social service workforce to be positioned to enable family care wherever possible. And we know that going back to the tsunami, for example, in Southeast Asia, where there was the risk that many would end up in institutions as a result of that, but then there was a lot of effort made to make sure that they were receiving family and community-based solutions. And that carries on, that debate's going on now in relation to Ukraine. And so I think that point is well made. And I think that there's a need for that kind of contextual background again, but succinctly.
Can you see the chat? I don't know if Chipo
no,
would like to.
No, sorry, I can if
that's
I open
okay.
it, sorry.
No, that's fine. Chipo, would you like to speak to your the comment you've made in the chat, your suggestion?
Oh, thank you. No, I was just thinking to add to the point on why strengthen social services workforce. I think it's also important to mention the legal obligations that states have to. So it's not just about us thinking social workers need to have this, but actually states have a legal obligation as per the UNCRC to actually do everything they can to achieve children's rights. So I was just thinking we could reference Article 4 in there, just to add to that.
Is Article 4 the one on quality services? I can't remember the exactly.
No, Article 4, that's the one which says something like states shall undertake appropriate legislative, administrative, and other measures, for the implementation of children's rights. And usually it's a good one to use because it covers quite a lot, and you can interpret it and make use it any way you want to make an argument for states to act.
Sure. Okay. Thanks. Yeah, that's really helpful. Let's see if there's Warren. I see you've made a few points here. Do you want to speak to your points? And maybe just briefly introduce yourself in making your point. Yeah.
Hi, good morning. I'm not sure if you can see me. I'm actually joining from my phone. But I'm Warren Thompson. I'm Director of Children and Family Programs at Child Protection Family Services Agency in Jamaica. And I'm also a member of the Jamaica Association of Social Workers, where I'm leading an initiative towards regulation of the profession. Now, the point I was making, and I think the point that Chipo just made is a very, very good point. Because when we talk about the legislative framework for supporting the social services workforce, you have to remember that some jurisdictions like ours in Jamaica, we do not have regulation or laws treating specifically with the social services workforce. So I was really trying to think about how do we, how do we set up a legislative context when within the state there may not be one. But I think the point that Chipo made is very, very good in that we can one way to do this is to get the policymakers to say, hey, we need legislation to treat with these things.
Okay, thanks for that, Warren. And I think
Whether it's paraprofessionals who work in residential childcare facilities.
Sorry,
Yeah,
sorry,
that's it.
I didn't mean to interrupt you. I think there was a pause in your connection, but great, thank you. And I think that there is often a view that somehow health and education services and workforce are essential and non-negotiable, and they therefore need to be budgeted so that we have enough hospitals, schools, doctors, and teachers. But that somehow social welfare or social services a bit more unclear, and maybe there, yes, we should pay pensions or we should do the absolute basic, but that and that children with disabilities should have a certain basic service. They might say yes, that there should be certain basic services, but they're not totally clear who should deliver those services. And it might be that they could be volunteers, they could be NGOs entirely, or faith-based organizations. So I think that that's a point well made, that actually, no, this is an essential workforce too, and therefore it needs to be in laws. But I think it's very good helpful to recognize that countries are at different places in that argument, and the advocacy, which is also mentioned at the end of this outline, might need to come a bit more prominently. That we need, the advocacy might be starting from a low level. Beth, is that a new hand?
It is a new hand. Just wanted to make a pitch for country examples. So we're really going to want to illustrate what we're talking about when we're making policy recommendations, and just mentioning of this one, this sort of idea of how do you begin to set up a legislative framework around the social service workforce if we've got examples from what you're doing in Jamaica now or from other countries. Let's make sure we include those, because I think it really does bring the thematic brief alive. I'm going to put the link for those for a shared document for those kinds of country examples in the chat. Thanks, Hugh.
Thanks, Beth. Sandy, I can see your hand is raised as well. Do you want to go next?
Yeah. Am I audible?
Yes. Yeah, please go ahead.
Great. Thank you. So I want to make 2 points. One, that thank you for this thematic brief. This outline. So it gives us a very good framework. If it has been included, so my suggestion could be ignored. But somewhere I feel that especially calling out the mindset of social service workforce for the entire care reform should be addressed upfront. Taking example from India, that because of the work they have been doing, obviously it is more towards childcare institution. Until now, in last 3-4 years, there is a fantastic change in India, but still, just to give you example, that when we interact with them and ask them that how many children actually you are responsible for, so immediately they count the number of children in childcare institution and they say, okay, these number of children. But the children, those who are on sponsorship program in Indian context, the children, those who are, related to some or other, maybe vulnerability situation. So this shift of mindset is also very important, that all children are their children. So this is something which, in terms of mindset, I would like to, highlight. And the second piece, in terms of when we say deployment of the workforce, I think somewhere we are going to connect of the appropriate capacity building in terms of all these 3 range of skill, attitude, and knowledge building, because this is quite a big shift from a caregiver to outreach worker. So I think that is something which I wanted to highlight. So yeah.
Thank you. That point's very well made, and I think that's what we're trying to cover in this the section B, where it talks about supportive social norms and attitudes. But I think that's, but very much you've explained it well, that it could be that even if laws and policies, somewhere like India, which has laws and policies, not just for a child protection workforce, but also very clearly that says that children should, there should be the priority that children grow up in families and that kinship care should be prioritized. That's already there, as it is in a number of countries that have got now not just children's rights-based legislation, but also care legislation that should allow for care reform or national policies. But in reality, that's still not being implemented, particularly if they fall back on a certain default. As you said, a default of caregiver, you know, my job is to care for the children who do end up in the institution and not more. And the other default mode is the bureaucratic mode, which is I sit behind this desk dealing with the people in the corridor who have a form to be filled in, but I couldn't possibly go out and identify unmet need. I don't have a vehicle, number one, and nobody would support me or reward me for doing that. And I would never be able to cover the population that I serve. So I'm going to carry on sitting behind this desk and getting people to fill in forms. And so that's an understandable position, but it's often a result of under-resourcing. But it's also ends up, they don't get fired for that because it's a bureaucratic norm. It's like, yeah, well done, you've done your job, you've dealt with the people in the corridor. So that these sort of defaults are often what underlie attitudes and norms. Not to mention other things that we need to talk about, like stigma, discrimination against certain groups that often lead to certain children from certain backgrounds more often ending up in institutions, or the workforce not wanting to work with their families because they feel that there's no hope and that, you know, these children are better off in institutions if they've got, you know, fill the gap, but it could be if they're from a certain background or if their parents are drug or alcohol users or whatever. So that's all what we would put under this social norms and this combination of attitudes and practices with knowledge. But it is a huge challenge to cover that all succinctly. I'm going to shut up because I want others to speak, but I'm just going to briefly give a plug. I think I mentioned it last time. We have another project that we're just launching in parallel to this one with Martin James Foundation funding that is really trying to drill down into this area of the actual values, attitudes, and daily practices of the workforce. And we're doing it from a lived experience angle. So we're trying to bring together young people who've had experience of social services and the care system to get them to speak about what it means to have, what's the difference between a social worker who makes a difference in their lives and not having one, or one that actually has been obstructive or harmful for them or for their family. So we're trying to learn from that and then help that strengthen training and advocacy going forward. Okay, that's absolutely enough from me. Florence, Martin, your hand is raised. Do you want to come in?
Just to add, I think that's really helpful to have you know, the work that you're suggesting in terms of understanding how children, young people care experience are you know, their perspective on the role of the workforce and what works, what doesn't work. I think it's also part of that is around the lack of recognition, not just legally, but the lack of recognition of the skill sets, the competencies that social workers bring. In my experience, social workers do not consider themselves, and they're not recognized, and as a result, they don't consider themselves as very critical to the system. And a lot of that has to do with the lack of recognition that these are genuine skills, these are expertise, these are critical role. And so I think it's also not just from hearing from children and families, but also linking this to the building of you know, whether it's a registration system, whether it's recognizing, and I'm not talking just a professional, also for the paraprofessional, but some sense of a system through either licensing, registration, and so on, that, and also, of course, the continuing learning that underpins that this is a fundamental role in society, that these are experts, that, because I often found with colleagues that, you know, while there is a much greater understanding of the role of, I don't know, lawyers, teachers, and so on, there's often a sense that social workers are just people. It's actually quite looked down on as a profession. I remember in Indonesia, there was a whole thing. They didn't want to be called workers because it sounded as if they were actually getting their hands dirty and things. And so they were like, oh, we can't, let's find another word. We're social something else, not workers. So I think part of it is around the recognition through licensing, registration, and so on. Part of it, I think, is something else. I don't know exactly what it is, but that requires a greater understanding of the incredible skill set, the complexity, the role that they play, that needs to enable social workers themselves to feel that they are that. So it's a mixture of both society understanding what the critical role is and social workers feeling that they're recognized. I'm not sure I'm explaining this very well, but I did find that often there was an enormous lack of sense of worth among social workers, and a sense that the expertise, the role they play is not recognized socially.
Right. Yeah. That's also a point very well made, and one that I'm very happy to hear voiced. And we did in that project I was just talking about, we have mentioned that the lived experience of social workers will also be included, but we're going to start with the young people and family members, because I think that's the bit that particularly there's a gap. But I see there's also a gap. I think also there's the thing about the sort of the social worker in a team or social service worker that goes the extra mile, that sticks their head above the parapet and says, no, I am going to visit families, I am going to focus on prevention. They often get knocked down. You're like, no, we don't do that here. We're not resourced for that. You won't be rewarded for that. Your performance will not be recognized for that. Just regress to the mean. Just carry on doing what everybody else is doing. Don't rock the boat, because you'll actually make it uncomfortable for all the rest of us if you go into those areas. Let's just carry on doing what we're doing. I think that's an experience that many in the workforce go through, combined with what you're saying about not being recognized as a profession, so or for their skills and training. So I think that point has to be made somewhere as well. I'd love to hear from the other Florence, because I see you've put a point in the chat here. Do you want to speak to your point, Florence?
Sure. Yeah, it's I do some guidance in situations of transition of facilities in India and in Kenya. I'm supporting social workers who work with families in crisis. So they do try to prevent separation. But if the point comes where parents really are unable and they can't find relatives, it's still, let's go to a CCI. But in both cases, I'm finding that they were not prepared for any of this in any way in their education. They have university degrees in social work. They are well qualified. Many of them have many years of experience, but this is completely new to them. The whole idea, and even in India, you would say a social worker would be at least aware of the Juvenile Justice Act, which does put things like foster care as options, and that should be prioritized, but they're not given that as their basic training, really. So there is a real need to put pressure on. Often curriculum in universities are influenced by politics. So kind of see to what extent policymakers can put pressure on universities to make sure that the curriculum is just more well-rounded and much more focused towards family-based care and supporting of families and gatekeeping.
Mm-hmm. Absolutely. And so it is influenced by politics. It's also influenced by academics who may not have practiced at any point. So they will teach it as they understand it from an academic point of view, but often that's not necessarily, whilst important, it doesn't go the mile to actually then helping in this kind of practice. There's been a couple more points. Thanks. Leon, do you want to, Annie, I see your hand is raised. Should we go to Leon and then to Annie? Is that okay?
Yes, let's do that.
Yeah, sure. Thanks, you. I was just reflecting as Florence was talking about the importance of recognition, and I'm thinking, the policy paper could also talk of the important role that practice regulation and as well as practice standards play, for instance, in social work, because this kind of brings in the what separates them from the next professional, and why it is important to invest in developing this kind of professionals, because they are recognized experts when it comes to this field. And this is the message that needs to go to policymakers. I've had experiences where you get a minister saying anyone can do this job, and this kind of weakens the position of the social services workforce, and they then tend to even start to doubt themselves, in terms
Yeah.
of their, you know, niche and their professional standing. So
Yeah.
just wanted to do that. Yeah.
Exactly. In a way that nobody would dare doubt a teacher or a lawyer or a doctor, mostly because we've all come across those and we've seen that they can be life-saving or life-changing, but not so many people have had a social worker. But social workers can be life-changing if we just need to get that message out. And that's a great point, well made. And just, Leon, you're from UNICEF in Rwanda, isn't that right? So just so that people are aware, where we didn't have a chance to get everybody who's speaking to introduce themselves. Thank you so much. Thank you, Catherine. Oh, sorry, Annie, and then Catherine.
No, I'm fine here. Let's go to Catherine.
Are you sure? Okay.
Yep.
Catherine from Bethany Foundation. Please go ahead.
Yeah, I think what I wrote in the chat was really what I was trying to get at, the you know, including some kind of, I don't know if it's recommendation, obligation, or just thought around faith-based organizations, missions organizations working in child welfare, running institutions, because they believe government aren't protecting children, and trying to reintroduce messages of working together with government, but also them having a professional social worker on staff when they're working with complex child cases.
Right. Yeah, I think that's a very interesting dimension. And actually, we were doing some work recently with the Salesian sisters who in India and Kenya, we helped an evaluation of their work on reintegration and more generally working more with families and communities. And the Salesian sisters, like many other faith-based organizations, had been for many years running children's homes. And there was a belief in the community that's a safe place for a child and also a good education for the child. But they were coming to recognize that there's, you know, that many of these children could be with their families or enabled to return to their families. And yet they also might not have the professional skills or capacity to, like, they committed to it. And obviously from a religious point of view, often absolutely agree with that a child should grow up in a family, but actually how to achieve that. But if they also fear government, I think that's an interesting point. If there is a lack of trust between the NGOs or the faith-based organizations and government, then how do they come together and cooperate in achieving this shared goal? Thanks, really interesting points to explore there. I've lost track a little bit of the comments that are already in the Google Doc. Maybe I don't need to read all of them. I'm just thinking if there's anything else that really stands out that's already been made that we should be talking about. I just want to briefly pick up on the points that that Anonymous has made. I don't know if is Anonymous here today. Is there someone here who recognizes who made those points? There might be more than one Anonymous, but okay, if you don't put up your hand, not to worry. I'll just try and, what I get from those points is more clarity on what kind of services we're talking about, and what kind of alternative care and definitions around that, and should we be looking at safeguarding and child protection issues. I think yes, but there's a real risk that we'll end up taking on everything in this paper. I mean, if you see this paper is covering two very huge topics and the linkage between them, it's covering child protection, care system reform in the context of child protection systems, but fundamentally about care reform and what does that mean. And it's also covering social service workforce strengthening. And there are volumes written about those two things. We will never be able to do justice to both of those topics. We want to really focus on the linkage, but we need to have good referencing and links so that, and maybe we can have our own short glossary, but we can also link to glossaries like the BCN glossary so that, you know, if anybody has any doubt what we mean by alternative care, or are we referring to residential care, then there can be references to that. But I think in this context, when we're saying SOPs and tools around alternative care, yes, we are particularly meaning the family-based forms of alternative care, because that's often the gap. As we were just discussing, often social service workforce know very well how to refer a child to an institution, but they might not know how to work on prevention, reintegration, or kinship care, or even foster care. So, and they might not understand the potential role of adoption in all of that either. So I think that's the bit that we might consider to be the gap in knowledge and also in practice. But yeah, Florence, do you want to come back on that one as well?
I actually wanted to do it. Annie first. Annie, did you want to come in?
No, Florence, go ahead.
I feel like we're jumping on over you. Just to say, I agree. I think that, you know, that the each brief needs to be careful not to try to address everything, because otherwise it becomes, you know, an endless brief. But I do think that one of the key things that's underpinning of course, the work around the UNGA resolution and the resolution itself is this shift of services. And that a transformation of system towards becoming more child-centered, family-centered, community-centered, and based. And I think part of what would be important for this brief to do is to recognize that and address, well, what does it mean in terms of the workforce? Because it is a major shift of workforce, as you know very well, to move away from a residential care-based model as the primary form to a family and child-centered. So I think part of what would be really important for this brief to kind of address is if states, as they are moving away, moving towards child and family-based care and care within families and communities, it actually has fundamental implication for how the workforce is supported, where it works, how it's resourced, what skills, and so on. So I think that having this brief really recognizing this at the front, you can't have transformation of systems without the workforce being transformed as part of that. It's going to be at the forefront of that. So I think that without getting into the details of the models of care and so on, I think recognizing that this is the shift that that's happening globally and that states have committed more clearly within the UNGA resolution, and therefore that has implication for what the workforce, how it's organized, what it needs to do, how it's, you know, the whole aspect of that. It's critical for it to even to happen.
Yeah. And I think that sometimes care reform is approached as if it's like pieces on the chessboard. You know, if we move those around, if we reconfigure the sort of structure, then the rest will follow. But actually, if you close institutions and you redesignate the staff that used to work in those institutions as now working in the community and supporting families, or you redesignate the institution as a center for families, it doesn't necessarily follow that it will then behave in such a way that is beneficial and useful for families and that helps children stay with families, because it might be that they never, as others have mentioned, they might not feel equipped and able to do that kind of work, so they revert to norm. So they sort of still refer children to another institution which happens to still be open, or they still remain behind their desk, whatever it is. So I think that governments can, yes, it's important to have laws and policies, but it's the follow through to actually make sure that the services are, and the attitudes that go with them are embedded is so important. I just want to reference the interesting discussion going on between Warren and Ian as well about articulating that these are not just regulations for the sake of regulations, but they are vital to safeguard the public, the children and the families. And that is a point that needs to be, governments have to have the confidence to say, as Ian was saying, sometimes NGOs tend to call the shots, and governments in some countries, they just sort of like act as the referee, but the footballers on the pitch, as it were, the active ones are often the NGOs. But in fact, we do want to encourage governments to speak up on this and to make a point, but still to collaborate with NGOs, and that governments to take leadership on these issues is definitely a key role. Anybody else that's not had a chance to speak or that would like to pick up on something? Then I think we'll need to come to the next steps. Just to reassure you, this Google Doc is not going anywhere, so you can continue to add your comments going forward. Yeah, please go ahead.
Right. I had some comments in the document closer to the end. I was trying to understand. I'm not sure if you could scroll down. I was trying to understand when we talk about promoting community-based models.
Yeah.
And addressing resistance. You had that on the advocating for the social service workforce. So I was trying to understand what exactly is this section supposed to be treating with.
Okay. We just to give you a little bit of context. So we for some time now we together with UNICEF have had this sort of scheme for how to frame workforce strengthening, and we divide it between planning, developing, and supporting. And so planning is, you know, those systemic things that I talked about. Developing is around the curriculum and the competencies of the workforce. Supporting is normally this whole area of, you know, what we were just discussing, that the workforce feel confident, that they feel recognized, that their well-being is addressed, that they have adequate supervision. And somebody has to advocate for that to make sure that's always in place and is so sustainably. So that's often a role for professional associations, but also governments and NGOs and the media. They all need to speak to reinforce that. So I think that that's advocating for the social service workforce in general is what we normally put under that category of supporting, you know, as it's recognizing they're professionals, they have a key and essential role, and that they have that key role in promoting and enabling community-based models. I think the addressing resistance would be anybody that's saying, well, you know, that these things are not going to work, it's not feasible, that you know, it's actually, we might as well rely on those institutions, we'll still need them, or resistance to investment in the social service workforce. But Beth, do you want to speak to that? And then I'll hand over to you also. But
Hugh, can I just jump in and
oh yeah, please, Ian. Yeah.
Just somebody earlier on said a government minister saying anyone can do this work.
Right.
We actually had that in Scotland a few decades ago, and yeah. So I think that's part of the resistance that has already been mentioned. When the job is diminished as, oh, usually any woman can do this. It doesn't need training, that kind of stuff. Okay, thank you.
I think so. I understood promoting community-based models. You and my comment in the document says this. I thought it was or would be better placed under services. So we're looking at how the services can change, and you know, in changing the services, we ought to promote community-based models. So and then addressing resistance would also be addressing resistance to that change. So I wasn't quite sure how these two things fit in with advocating for the social service workforce.
Okay, I think that's clear. I think that maybe we could clarify that.
Yeah,
because that primarily is about advocating for the workforce to do a good job, isn't it? Sorry.
I think we also have to remember again who the audience is for the brief, and you know, what the purpose is behind it. So I think, like Florence said earlier, you know, we'll probably have to make some decisions about what fits in this thematic brief and what doesn't, and where it best fits. So those are great points, and I noted those down. Hugh, we just have a few more minutes. I wonder if you want to move to the next steps, or if there are any final points over.
Yep, fine with me if everybody's okay to move on. Yep, over to Annie then. Would you bring is there a slide for this? Or should okay, cool, thanks.
Okay. Thank you. And thank you, colleagues, for the very lively conversation. It's really very, very useful. Just wanted to mention that the document, the link that we shared with you in the chat, and we'll share again, most of you already have it, which is the link to the outline. We'll keep it live until the 20th of December. So you have another few days to go back to it. If you think of something new that you want to add in terms of your comments or some other thoughts that you may have over the next few days, please go ahead and include your comments in the outline, because I think the conversation that we have had today and your comments are really something that's going to shape the document going forward. And I think that is probably going to be a key indicator of the collective ownership of this document in terms of, you know, how well the outline has been agreed and, you know, worked together on, including by building a consensus. So please, if you have some time, provide your inputs to the policy documents. We wanted to request one more thing, because I think, Beth, you mentioned it a couple of times during the course of our meeting today, is about case examples. You know, we don't want to really have a document that reads either a very policy document without any concrete examples or a theoretical or an academic article. We want it to become live. We want it to be reflecting the realities of what's going on the field. So we would really request you to start thinking about case examples from different countries. And Beth, thanks for putting that link there. It will be great if you can provide some policy and practice examples, either from a country where you're from or where you're worked in or currently working in. I think that's what is going to really make this thematic brief unique and more interesting for readers who are who are interested in finding out what others are doing and then trying to see how they can use those learnings in their day-to-day work. So those are the two important documents, and for the case examples, you have time until the end of January. But the last point I wanted to mention was about signing up of the drafting committee. Please send us your interest by email in terms of who would be interested in signing up for the drafting committee. We all recognize that all of us have a lot of other things to do, but I think this group is filled with so much expertise and so much knowledge of the in the area of child protection, in the area of care reform, as well as in terms of social service workforce, that we will definitely benefit from your contributions in terms of drafting the thematic brief as well. So please let us know if you're interested in signing up for drafting certain sections of the thematic brief. Yeah, thanks, Beth. Beth has put there her name, and you can send an email to Beth there on that. So that's about the summary of today and the thematic brief and the case studies. As we are coming close to the end of the year, we are planning that we will have one meeting of the drafting committee sometime in January, which will obviously be a smaller group because not everyone in the task force will be there on the joining committee or the drafting committee, although we would like as many of you as possible to join different parts or work on different sections of the thematic brief. And the full task force will then meet in February next year. So that is the overall plan. We will be very happy to hear your feedback as well. So please let us know by email or chat here what you think about these next steps. We are really looking forward to working together on this as a collective of all of us. So that's what I wanted to say. And before concluding, I just wanted to check with both you and Beth if you had any additional points to make before we close. We have a minute and a half. Thanks.
Nothing further from me. If anyone has any questions about the drafting committee or wants to have a side call to share anything, I'm happy to be available for that. Thanks, Ani.
Yes, if you're at all worried about volunteering for the drafting committee, then please just let us know, and we can be flexible in recognition that you might be. I'm sure you're all very, very busy, so it doesn't need to be a huge burden, but we would love to have one or two more to join that group. That would be wonderful. It's just going to have a few meetings and then reading things in between. I don't have anything to say. I've put a point about advocacy because I feel policy and practice and advocacy examples. I mentioned that we're starting on something involving care experienced youth, but you might have existing examples of that kind of thing, different voices, giving voice to the voiceless, that in helping to make this point, as well as the more traditional forms of advocacy. Be great to hear examples of how that's really made an impact in this area. That's all from me. It's been a wonderful meeting. We covered so much. Thank you.
Yeah.
Sorry, Ani, one more.
Yep.
Sorry, one more quick point, because I'm just thinking if people don't have time to join a drafting committee, that's no problem. But do consider going into the shared document and writing up, very brief, short paragraph examples from your practices in the countries where you're working. Thanks.
Thank you, Beth. So we have come to the end. We are actually past 1 minute over 9, but thank you so much, colleagues, for your very active participation. This was an extremely engaging conversation that we had, extremely beneficial going forward in terms of shaping the drafting brief, shaping the thematic brief. And as we come to the end of the meeting, as well as the end of the year, those who are celebrating the new year very soon, wish you a very happy new year. And just wanted to thank Beth and Hugh and Alina for supporting organization of the meeting today. Thank you so much, everyone. Have a good weekend.
Thank you, Annie. I just noticed that Carolyn has just joined us. Carolyn, there may have been a time mix-up. We're just finishing, but by all means stay, and we can talk for a little bit.
Okay,
as others leave.
I'm sorry. I must have recorded it when I was in Bangkok or the Philippines, and it's on time. Sorry.
Yeah, no, that happens often. Yeah, but stay on the line a little bit. Maybe we'll have a quick chat.
Okay.
And Beth, if you have a moment, we could stay on for a little. Yeah, but for everyone else, thank you so much. It's been a wonderful meeting, and you may not have had a chance to say what you wanted to say, so please put that into the Google Doc. Thank you so much.
Thanks, everyone.
Thanks.
Carolyn, we'll share the.
I'm sorry, I need to jump into another call.
Okay.
So see you.
No worries, Annie. No problem.
Bye, Annie. Thank you.
Bye. Thanks. Bye.
I'm really
Bye,
sorry.
everyone.
I think
Bye, Warren. Thanks for joining.
I think when I went from Bangkok to the Philippines, I think that's the 1 hour difference. I think that's where everything, the same thing yesterday. I turned up 2 hours early for the appointment.
Bye, Ian.
Oh, really? Okay.
Sorry, can I just jump in to save me typing a fast email and mistyping? Beth, I would be willing to be a kind of reserve or backup for the drafting group.
Excellent.
But I increasingly feel strongly that we need to bring forward some of the other colors and races and parts of the world to really engage with the language. And like Leon was making very interesting contributions from a Latin American's perspective. And I think, therefore, I really want to hold myself back, but I just wanted to let you know I can be a reserve if you're really looking at a big gap and you really need some extra little bit of help. So that's all.
Excellent.
So
thank you. Thank you so much, Ian. That's really appreciated. And we've got a few people already and good representation. So I'll definitely tag you.
Thank you. Bye now.
Thanks, Ian.
Bye, Ian. Thank you. Carolyn, we can share the notes as well as the recording too, so you can kind of hear what other people have been saying. But we went through the outline. I think it was a great discussion, Hugh. People were engaged and gave some input on the outline, and would welcome your inputs there too, Carolyn.
Did you already have a chance to see the outline?
No, I haven't. I've been on a mission. Do you want to just share it?
Yeah, it's a Google Doc. Maybe could you drop it into the chat, Beth, if you've got it?
Yeah, just a second. I'll do that. So
yeah, it's still very much live. We'll keep that Google Doc up until January. Did we? No. When did we put a cutoff point for?
Till next week, actually, because then we'll the 20th. Sorry, I'm having trouble getting it.
I've got it. No, I've got it.
Okay.
So yeah,
We've just done. We're just finishing today one on Jordan's social services workforce, and we will finish in another week's time one on Bangladesh social services workforce. Both sort of mappings with a lot of data.
Fantastic.
Yeah, I don't know how useful that is to you. And we use the questions, Hugh, which we have lots of comments on, as you know.
Sorry, which questions? Did they mean the questionnaires?
The questionnaires, yeah.
Oh yes, absolutely. No, and I'm still pushing that as a project idea that we need to revamp and revisit that that whole toolkit. But I haven't yet found a taker to fund that as a piece of work. My instinct would be to go ahead anyway, but I'm learning rather too late in life that one has to be a bit more business minded, and it should be properly funded. Then we can all do it well. So I'd like to.
Ouch! That's a hard lesson to learn.
I know. I'm very. It applies to my personal life as well as my professional life. Saying yes to things and then suffering the consequences. So I mentioned to Annie that also maybe with UNICEF we could jointly propose that to some of their funders. But I know they have a huge list of things that they're constantly trying to propose to funders. But either way, you know, if anybody here's anybody who might be interested in supporting that kind of a piece of work, I think it's a nice kind of, not quite low-hanging fruit, but maybe sort of bite-sized piece of work that has a very tangible outcome. And it could be very much about updating, increasing accessibility, usability, making sure that people can use it, not just at national level. They could do it at a sub-national level, or they could do it for a specific element of the workforce, like we did in.
I mean, most of what we discover when we use people's questions, and sometimes the same when we do our own tools, is that they are too complex for the situation that you find on the ground. And so they're not really, you know, they don't cover what one needs to cover. But I suspect that's sort of inevitable, because you probably need to use them in a number of countries before you work out what will work and what won't work. Yeah. No, it's very much a need.
Carolyn, I was just going to say that I put another link in the chat there for you, which says, for examples. We do want to collect some, you know, concrete examples to be inserted as very short, like 1 paragraph kind of case examples. So mapping in Jordan, the things that you were just mentioning would be perhaps really great contributions for you to add. If you have time. Again, we wanted to keep them brief, so that would be great.
Yeah, okay. Well, we can send you a sort of executive summaries if that would help, would it?
Yeah, I think that would be good.
We're talking about policy or practice or advocacy examples that are about strengthening the workforce to be more able to achieve care reform and family-based care. I was just thinking, since Carolyn and I both know Kyrgyzstan quite well, that whether not just successes but failures would be good things to put, but it's difficult.
Yeah,
because
definitely.
We don't want to name and shame, though, do we? So I just think.
No, but it was quite interesting in Kyrgyzstan. You know, I worked with well, it was UNICEF, but with Hugh's wife, and the Ministry of Justice and an NGO had drafted the Children's Code, and we had tremendous. You know, they didn't want to go with all my ideas, which is fair enough, and went with their own, and then ended up having to change it 3 or 4 years later. But I think it was interesting, because I think they learned a lot from doing that, and very sort of, you know, they were very forward with it all. But I don't know whether it was maintained, because I haven't worked there now for a number of years.
Well, I don't really know either. I mean, the thing that I think about most with Kyrgyzstan is failure to follow through on the attitudes and practices, having adopted laws and policies roughly similar to the likes of Moldova and Georgia and all those other countries that we always mention, but then never really following through. So that when you've renamed an institution as a family center, and you've renamed a caregiver as some kind of a therapist or outreach worker, and then they go away and say, well, job done. But then actually it's not job done, because they probably keep a few beds in the corner of the family center, and then they end up accepting children to be institutionalized. And the workers don't know how to work with families in the community. So they just say, well, this institution is closed, but I would recommend taking your child to that institution. Oh, especially because your child seems to have a disability, definitely go down the road. And so those things didn't change. The EU spent, what, 5-10 millions creating this literally meters high of policy documents to all this so-called transformation. And I don't think it really changed much of the fundamentals. So that's the worrying sort of tale that I again,
all of this. I don't know what you think of this. So we've now finished the 7 evaluations on childcare reform in Eastern Europe and Tajikistan. But I mean, Tajikistan's, let's forget Tajikistan at the moment. And we're about to do North Macedonia.
Right.
And so you look at how well have they done. And in many ways, I have to say they have done very well over this period. Really, we're looking 2009 until the present, but say from about 2006, they really get going. And as, of course, the EU is a tremendous player in this, pushing them to reform because it's part of the accession criteria. And so on they go and on they go, and they do, for the most part, get rid of the large residential institutions. Okay, they've got small group homes, but that's sort of, you know, that's going to be the way it goes for the moment. but they do an awful lot. However, when you look at social services workforce, they haven't really reformed the nature of the way they work. So they're still doing maintenance claims, and they're doing the, there's no specialist childcare staff. They're all doing generic work. But then I wonder, and administration, of course, let's not forget that. So they're all overwhelmed, overloaded, inefficient, blah, 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 blah. But I actually wonder, with all of this, whether in truth they really have a child protection system, or whether now they need to pivot, they need to move away from this focus on deinstitutionalization and residential care and start focusing on prevention, support to families, that line. So, so that alternative care becomes a tiddly little issue rather than a major issue, because most children are supported in their families. I mean, that's
exactly
one of my conclusions from doing all of this, and I've told Aaron Greenberg that that's what I think. The other thing I noticed, and sorry to bore you with this, but I don't get many people
it's interesting
about this.
It is very.
Is that when you look at all of these countries, foster care is going down, down, down. They have real trouble recruiting and retaining foster carers. One reason being, of course, that you get what I call bed blocking, which Hugh will understand, but they don't move out. So you're constantly having to recruit new foster parents because there's no exit strategy for these children. They're not being reintegrated, and there's actually nowhere else for them to go. So
Moldova is such a fine example of that, having more children in foster care than they ever had in institutional care. Something is not working.
I think it's a failing myself.
Yes, I do too.
Today, as you've probably seen, Hugh, they launched in England a new kinship care strategy. And I realised with interest, they've got the same problem in the UK. They cannot recruit enough foster carers. And we were talking about why can't they? I mean, I think one of it is financial downturn, that even with the allowance, people go out to work. I think it's probably also demographic. People have children later. So whereas a foster carer might have taken children when she was in her 30s, because she's already got kids and might take a couple more now, because they're not having children until they're well into their 30s. So age is going up all the time, and they're not so keen on taking more kids. I don't know. I thought it was very interesting, but perhaps we should be looking at much more support to kinship care, and in terms of payment, which is sort of anathema to most developing countries.
Yeah, no, absolutely. I couldn't agree with you more on both those points, on prevention and kinship care. And I'm guilty, having been a trainer of social workers that spent a lot of time banging the drum on foster care, from that it can't be done in isolation, and there's always the law of unintended consequences, when you and I think that's what we're discovering now, and it is a bit depressing that the numbers in foster care are going down. But that's a metric that has to be read alongside all the other metrics as well, because it could be a good metric if more children are staying in families, or maybe they're going into foster care, but for shorter periods of time. But that doesn't, as you say, it doesn't seem to be that's the case. It's just more, So Anyway, we're gonna just to tell you something that came up. There was a big point about the morale of the workforce, and the workforce feeling themselves confident to speak up for their role and their essential role, and making sure that governments actually do that rather than constantly underestimating the importance of professionalism in the workforce. And the other point was just how difficult it is to get the right balance in a very short and concise paper between the two topics that we're combining. One is how to reform a care system, and in the context of child protection system strengthening. That requires volumes to explain, as does social service workforce strengthening. So people were saying, why don't you going to need to explain that and that a bit more? And we're saying, yes, but we want to mainly focus on the linkage between those two things. So we need really good references and footnotes and things, so that we don't end up biting
You
on
want me
more
to
things.
help in any way? I mean, I was hearing what Ian said. I mean, just if you want me to do some of the drafting, I'm happy to do
Great.
that within limits. But why don't you just let me know what you'd like me to do, if I can be of
Ruth.
use?
I think
you
we
know?
could let's
Um,
put Carolyn
mhm.
with Ian, shall we, in that subs
Yes.
bench as definitely
Yes.
someone we would draw upon.
Yeah.
I'll
Yes,
tell you
for
what
sure.
I could
Mhm.
do for you is edit, to
Oh,
look
wow.
through
Great.
when they've done it and edit it, yeah, and say, what about this and what
Great.
about, yeah?
Great.
Wonderful.
Yes,
Thank you.
fantastic.
They could have
Definitely,
first
that would be
go,
really
see how they go. Yeah.
We'll
Hi,
make sure.
Ruth.
Yeah, Ruth was just joined. Hi, Ruth.
Hello, hi, how are you?
Very
None
well,
of it.
Hi,
thank you.
good. We're actually just wrapping up. The meeting was an hour ago, sorry to say. But we will be very happy to share notes and recording.
Thank you, Beth. Sorry, I was in another meeting. Sorry.
Oh, don't be sorry. We're glad to see you.
Ruth,
Go ahead,
do you want? Do you have the Google Doc link? Do you, because but there's still plenty of, well, in about another week to add more comments into the Google Doc.
Yes, please. Yes, please.
Yeah, so by all means do that. Then we'd love to hear from you that way. But yeah, we're basically over. We just carried on a bit talking with Carolyn because she also arrived at the very end. Is there anything that you wanted to say, particularly today, or will you put it into the Google Doc?
No. Honestly, no.
Okay, well, great to see you, or great to thank you that you joined. Okay, thanks everyone.
Thank you,
I think
Hugh.
we'll
Bye-bye.
get going.
Thank you, Carolyn.
Bye.
Okay, all the best. Okay, see you soon. Bye-bye.